I ran it by a bunch of my classmates. Like, hey, is this a good idea to leave medical school and do this? Like, I really want to do this. And some of them at first were like, you're crazy. Like, but eventually I kind of got that positive validation from some of my classmates that like, hey, this is, you clearly care a lot about what you're doing. I think you should give it your best shot because you're going to regret it going through medical school, going through medicine, and looking back and asking what if for the rest of your life.
Welcome to the Physician Pharmacist podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a former pharmacist and current anesthesiology resident. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we've had the tremendous opportunity to broaden our scope and explore other non-traditional careers. Tune in to hear from our non-traditional experts serving at the frontier of medicine, technology, and innovation. Today, I have the pleasure of speaking with Sash Sriram, who is the co-founder and CEO of Lamics, as well as a former medical student who'd made the daring decision to step away from medical education to pursue a path with the potential for even greater impact. Lamics is a tech startup company designed at reducing insurance denials and simplifying the medical billing process for healthcare providers through the integration of machine learning. Consider it a charting co-pilot that will help minimize errors, limit paperwork, and get clinicians back to doing what they truly love, patient care. All righty. Thank you so much for being on the show tonight.
Yeah, thank you. I'm glad to kind of have this opportunity to kind of share my story and that kind of thing. So thanks for having me.
Absolutely. Well, I think we definitely have a lot to unpack. And let's start things off right at the beginning. So what was your life like before going to medical school?
So before medical school, so I went to undergrad at The Ohio State University. I did nutrition sciences as my major. So a lot of my work during undergrad was kind of like a mixture with research, and I actually worked full time as an EMT for most of undergrad. So that was kind of a painful part of my life, working night shift while in school. But I made it work, and so that's kind of what I was doing. And then towards the time, like after undergrad, during my gap year, I took 1 year off before I applied for medical school. I started a nonprofit organization kind of alongside my nutrition background. I think it was really important to me to allow people to have access to food, which is a basic necessity of life. So that's kind of what my background was during undergrad and kind of thing. So
yeah, that's super interesting too. And with nutrition, like that's a very unique background to applying to medical school. I feel like most people take the traditional path of being like a biology major or a chemistry major, and that's about it. So was that helpful with applying to medical schools?
Yeah. So backstory, I actually started my major as microbiology. I kind of fell into that trap of, hey, everyone's doing biology, might as well do something that's kind of cool, microbiology, right? I didn't really know what I was getting into. I joined a research lab, and I didn't really like it. So I'm the type of person where if I do something and I don't like it, I don't do it. So I know medical school has all these requirements, like shadowing and that kind of thing. But I think it's really important, at least, to do things that you like to do that kind of overlap with what medical schools want. So in terms of like research and stuff, I switched towards nutrition research, and that's kind of where I went with that. And
Absolutely.
Yeah. So with nutrition, I'd say it really did help me kind of with the medical school process. I think nutrition is something that's not really taught in medical school that much. So that's kind of something that I kind of advocated for while I was in medical school, to bring more education on a lot of the diseases that come with nutrition. I believe that a lot of everything comes down to your lifestyle and what you eat, your exercise, those kinds of things. So
yeah, that's definitely an interesting take too. And I'm partial because my fiance is a dietitian, so very nutrition heavy in this household. But Yeah, I think that's really cool that you're able to use something that you were super passionate about and interested in. You didn't just like go with the run of the mill biology, and you made that switch, which I think is important to kind of follow the things that you're passionate about. And obviously you're 100% correct. We don't get a lot of nutritional experience at all in medical school or any kind of education. Partly I'm biased too, because I'm a pharmacist, and I think our pharmacy education is lackluster in and of itself. But yeah, it's like I'm trying to think back to the things like wet berry and all that stuff. But that's very, very top level nutrition and not really clinical either. So
Right.
what kind of ways did you try to implement some of this like nutritional education into your curriculum?
Yeah. So I think funny story. Our entire nutrition lecture is one lecture with like 100 and something slides that they go through in like an hour, which was not the greatest experience, at least from hearing from other people. Just um, I know that they have a lot of content to get through, and they don't have time to fit in all the nutrition stuff. But I think a lot of that information is really important, like the where zinc plays in some of these pathways, magnesium, all the trace minerals. I think that's fundamental to a lot of the pathways that you learn later in medical school. I mean, biochemistry is kind of the fundamental to everything. So um, I talked to the lecturer. She was really like nutrition focused. Her name was Dr. Slitro. She was the greatest. And we kind of talked together to try and see how we can implement more uh, adequate nutrition education, whether it's within the curriculum itself or whether it's kind of outside of lecture, these seminars, bringing in a dietitian to kind of inform people how they can talk to patients related to nutrition issues, et cetera, right? So.
Yeah, definitely a lot of touch points for impact there too, in the sense that not only would it be beneficial for us to know for our patients, but as you're probably well aware, the medical student diet is also atrocious. So it's, you're so busy studying that it's difficult to find time to cook quality meals. Maybe that's just an excuse, or I don't know. I was just lazy, but that's awesome.
Yeah, I mean,
And
I was living off of ramen noodles, so I mean, I couldn't say that I was the best at that, but coming from someone who was a nutrition major, it was still pretty difficult to kind of fit in nutrition into our really hectic lifestyle. So.
awesome. And so kind of talking a little bit more about medical school, and was it always your dream to become a physician, or was that always like your initial passion before kind of making, a switch later on? And we'll get into that in a few minutes here. But yeah, I'm curious to know, like, what was the origin story for why you wanted to become a physician?
Yeah, so actually, I didn't want to become a physician for most of my life. I actually love marine biology. I kept fish growing up, and that was one of my favorite things. So during undergrad, one of my biggest hobbies is scuba diving. So I'm a PADI rescue scuba diver. So that's kind of one of the things that I love doing. But I realized that the thing that I really loved about scuba diving was, looking out for the people that are newer, kind of handling the emergency aspect of when things go wrong. So that kind of segued me into like EMS. And then on the side, actually, my mom actually suffers from a condition called retinitis pigmentosa, which is essentially she's blind. So that I've been having to live with that for most of my life, but that didn't actually directly lead me to medicine. It kind of was the thing that I was like, my lifestyle is just taking care of my mother, right? But I actually really love doing that. And, going into EMS, realizing how important it is to not just, treat someone just for their medical condition, but understand that they're in their most fearful point in their life at that moment. So kind of supporting them through that time um, and just being there for them. And so and I just absolutely love doing that. So that's kind of what led me towards medicine. Um, so yeah.
Yeah. Thanks for sharing that. And so talking a little bit more, so you had these, high hopes and you love the patient interaction, but obviously the first couple of years of medical school are extremely limited when it comes to that kind of exposure. And unfortunately, you don't really get a lot of that exposure until like later in the education process. So, what was kind of different from what you were expecting when it came to starting medical school?
Yeah. So, I mean, starting medical school, I mean, we did have these things called like SP encounters where they're standardized patients. You go in, talk to people, but it wasn't the same as, you know, talking to some of your patients. Like back in EMS were some of my greatest times. We had patients that we would take to dialysis. I worked in both private EMS uh, and I worked 911 as well. And we had patients that I've had for over a year. And you just make friends with them, right? Like you cherish them like they're your family. And I guess once you're in medical school, you kind of, that you're learning all these pathways and all this medicine, and you know that it's going to do good for someone down the line, but it is hard to kind of refocus yourself towards knowing why you did this, and just reminding yourself over and over that um, you're learning the stuff to provide the best care for your patients in the future. Was kind of how I got through, but I'd say most of it was mainly my classmates and just kind of hang around other people that really are passionate about medicine, um, and also hanging around people that are not in medicine is really important too. I think um, you kind of go a little insane after you see path slides all day, but yeah.
Yeah, I couldn't agree more. And it's definitely tough to see like the big picture, especially in those first 2 years when your nose is in a book the entire time. So, to any of our listeners who are about to start medical school, that's definitely something to keep in mind is go touch grass every once in a while. Get out there and talk to someone who isn't in your lecture hall all day long with you. Because it kind of serves as like a point of grounding where you're able to kind of get away from all the chaos that is medical school. But anyways, I'll get off my soapbox. So tell me a little bit more about, so you started medical school, you did your first year, and then halfway through your second year or third year. And at what point did you start to make the decision that maybe this isn't the career path that I want to pursue?
Yeah, so I mean, it's not that it wasn't the career path I wanted to pursue. Medicine was always everything. So it was definitely a very challenging thing for me to kind of step away from. But I think back in March of last year, just context behind the story of, I guess, our origin. One of my friends, Thage, I've known him since like high school. He's a software developer. He does data science. And we were playing video games one night at like 2 a.m, and he was talking about how he was creating this medical coding tool for his sister who was in cardiology residency. And I was like, it was just right place, right time, because that same day we were having lectures on the entire insurance issue and talking about ways we can address the problem. But I'm the type of person that I love to raise my hand. I asked, like, what's the solution? And um, healthcare reform, I guess. But I don't know how feasible total healthcare reform is. I think a lot of it has to, I don't know if that's going to happen, right? So waiting around for that to happen, I think was not in my wheelhouse. And so I wanted to take it in my own hands. And hearing the opportunity come from my friend that was just working on this tool, my eyes lit up, and we started working on this and kind of learning more about the problem. At that time, I don't think like I made that decision to leave medical school. This just kind of turned into like a side project. But after a couple of months of just talking to all these physicians and learning how we can actually solve the problem, kind of shifted me towards the developing something people actually want. I think that's one of the fundamentals in business is don't just build something talk to your users, talk to the people that are actually going to be using what you're making. And so we kept doing that, and I learned a lot more shocking things about the industry and learned a lot more about insurance and how all these medical codes work and that kind of thing. And it just drove me a little bit insane, but in a good way. So it kind of drove me to work really hard to try and solve this problem. And eventually, it turned into something that I really wanted to do. And I ran it by a bunch of my classmates. Like, hey, is this a good idea to like leave medical school and do this? Like, I really want to do this. And some of them at first were like, you're crazy. Like, don't do that. But eventually, I kind of got that positive validation from some of my classmates that like, hey, this is, you clearly care a lot about what you're doing. I think you should give it your best shot, because you're going to regret it going through medical school, going through medicine, and looking back and asking what if for the rest of your life, right? So that's kind of why I took that jump to leave medical school and do this. And everyone's been super supportive. So I'm really grateful for everyone that's been around for me.
Yeah, I think that's incredible. I mean, you made like a massive sacrifice and you recognized a huge pain point, a huge problem that is pervasive across the medical system as a whole. And like you said, it probably would have been maddening to continue throughout medicine, knowing that you have the potential tools to resolve this issue and you're not putting 110% into it. And it's really, really difficult, especially to kind of focus on two different things while going through medical school and through residency as a whole. That obviously down the line once you got to that point. So I think, yeah, it would have led to a lot of discontent, and you kind of split the baby in the sense that you're only 50% invested in medicine, which can lead to, worse outcomes for patients, theoretically, depending, obviously you would prioritize patients, but you know what I mean? And then you're not putting as much into the business as you would like to do. And so, yeah, I think that's incredible. And so how far into medical school did you get before you decided like, okay, this is what I need to do?
Yeah, so I got mostly through, I almost finished my blocks. So I only had a couple more to go. I was just like,
Wow.
I was in the talks with the dean and my advisor saying like, hey, let me just finish off these blocks and take step and then leave. But then I guess the workload kind of got caught up to me, and obviously you can't do both at the same time. And I didn't want to by doing both at the same time, I was doing both an injustice. So I really wanted to just pick one, right? And I knew GI was coming up, and I've heard that it's a very challenging course, at least at our school. So I was maybe a couple days into it, and I was like, this is too much. I'm going to lose my mind. So then I told my advisor, hey, I think it's time, right? So and then we went through the whole process, and I got, so just to clarify, I did take a leave of absence, essentially. I didn't completely abandon medical school. I took a leave of absence for a year, but I think this is where my passion really lies, and I have the opportunity to come back in the fall of next year. But considering how this is going, I think I really want to continue doing what we're doing, and I think it's for the greater good. So, yeah,
I love that. And so with your company, Lamics, and did you, when you decided to take this leave of absence, how far along were you? Because you had mentioned it was like a side project. Like, had you built a minimal viable product? I know you said you had reached out to some faculty and some other markets to see, like, is this a viable product in the first place? But, how far along were you where you actually, like, did you have traction at that point in time when you decided to take the leave?
So funny story. So like back in the spring, we had this idea. We worked on it for like 3 weeks. And then we had literally a box and an output, and it was the ugliest thing ever. And we applied for Y Combinator, in California, and we somehow got into the top 10% with absolutely nothing, which was kind of crazy. But then as I kind of learned more about the industry and learned more, we really wanted to focus on just solving the problem at its core before going for any fancy funding or going through an accelerator. I know an accelerator can be very valuable. And we have been continually applied for YC and stuff. But sometimes things don't work out. But we're still kind of working hard to, do the thing that we're doing, right? Build the product, talk to users. At the point where I was leaving, this is kind of when we've kind of finished most of our what's called customer discovery. So this is when you talk to as many people as you possibly can and kind of just bring up the idea and learn about what their pain points are and what kind of problems they're experiencing. And then we actually posted on Reddit and just to get feedback as well. And currently our physician champion, he's out of Texas. We actually met him on Reddit of all places, and he GM'd me, and we got on a call, and we flew out to Texas to work with him, and that was a very fulfilling experience. And so, yeah, just hearing how happy we were making people just by bringing up the idea, showing something that doesn't even work, kind of rang the bell in my brain that, hey, this is probably something worth doing. So yeah, that's kind of what brought me to kind of just leave and focus on this full time. And yeah.
Yeah, for our guests who are curious about Y Combinator specifically, we've actually had a Y Combinator guest who applied five or six times to the program before getting accepted. So my, I guess, advice anecdotally is to continue to apply. But for our guest, that's episode 14, Derek Borkowski, creator of Clinical Pearls. And so, yeah, I think that's awesome. So you've met some guy on Reddit who happened to be a physician, and he's like, hey, this is a great idea. And you already knew it was a good idea, but he said, come down to Texas, come meet up, let's set up a meeting basically, and let's talk about the business plan. And was that at that point, did you guys start the company officially, or were you in the process of already having that kind of taken care of, and you had the nice website designed and everything like that?
Yeah, so I think we did that way earlier on. We were just we know we want to start a company out of this. We kind of just jumped in. We were YOLO, right? So we didn't have any traction. We had nothing. We just knew that this is a problem we wanted to solve, and we were we're gonna do it one way or another, right? I think it's the main thing that sure, you might not see the immediate results, but it's kind of the definition of insanity when you work towards something over and over again and you keep seeing that it's not working yet, but it's a yet, it's not an if, it's a when, right? So we knew it's possible because there's other companies developing technology to do essentially for different tasks, right? Not for medicine, but we knew that the technology exists to solve the problems that we need to do, right? And so we knew it's possible. It's just putting in the work and making it work, which is a whole different challenge, right? So, yeah.
Absolutely. And I think you brought up a point earlier too, that I think a lot of startup founders struggle with is trying to build this beautifully polished, platform that has all the integrations that you ever dreamed about. And the UI UX is fantastic, right? And that is not the purpose of your MVP by any means. And I think a lot of people will get hung up on that, where they'll either take all the time in the world and all their effort building this product, and then finding out later on that no one wants it, or B, they try and input all of that information, like I said, and they get stuck and they never even advance to the next stage. So I think that's great that you guys just had a little box, input, output, very, very simplistic.
Yeah. I mean, it was a just continual cycle of developing something and then scrapping it and then developing and then scrapping it all, it was definitely very mentally taxing, but I know that's the thing that needs to be done. Actually developing something that is usable and people would want to use is very challenging considering how already clunky some of these EHRs are with all these buttons. So we don't want to add to the problem. We want to try and, solve the problem best we can within our limitations. But yeah.
Yeah, there's definitely a major market need. I mean, because physician and just healthcare burnout as a whole, the number one cause of all of this is related to over documentation. And I think that your platform is going to be a great tool for a lot of people in the future. So without further ado, tell us, what does Lamics offer and what is the primary goal that you are trying to, I guess, obtain with the
So
platform?
essentially we're creating essentially like Grammarly for clinical documentation, right? But not in the sense of just grammar, but in the sense of, hey, each insurance company has their own set of guidelines. They have rules that they have to follow to adjudicate claims. Like, hey, if you want to get a tonsillectomy, you have to meet XYZ, right? Now, there's thousands of pages of these. No one has the time to go through Cigna's thousands of pages, and then for the next patient, then go to Anthem and go through the thousands of pages, right? They make that publicly available. So having that information and then providing it in a way that clinicians can use in real time while they're documenting is super valuable, right? So I think essentially what we're doing is while you're documenting, it'll identify pieces of text or pieces of evidence that correlate with those guidelines for a specific procedure or CPT code that you're trying to bill, and tell you, hey, what documentation are you missing, and is what you're saying, does what you're saying make sense, right? So using their own rules, using their own language in your documentation to kind of get that approved could be really beneficial. So that's kind of the route we're taking. The other side of things, a big pain point is the whole prior authorization headache. So there's a company called HL7 that makes this thing called FHIR, which is like an interoperability data standard. And they have mandated most of these EHR systems to kind of adopt this so that you can take data from Epic and put it in Cerner, right? And it's all mapped out. But the main thing that needs to be addressed is, why do we have to, when we have to submit prior authorizations, go through 2 or 3 different portals before it gets to the insurance company? Why can't they just, and why do you have to, all that information is already in the EHR, right? So why do I have to enter that in 2 or 3 times again, right? So I think the key to that is using that standard to directly interface with the insurance company without having to go through all these loopholes. So that's another problem that we're exploring. But our main priority is kind of like solving that transparency issue and bringing that to like the clinician's workflow.
Super interesting. And to kind of add to that, on your website, you also talk about how almost $100 billion is lost every single year due to medical billing errors. Can you explain that a little bit further, in the sense that, is that due to like rejected claims, or I'm not entirely sure what that is specifically. So I'm hoping you'd be able to expand on it.
$100 billion. This is essentially claims that are denied for reasons that they shouldn't have been denied for, due to either incorrect coding, not filing the claim on time, incorrect patient information, inadequate documentation of what's called medical necessity, those criteria that need to be met, and just things that shouldn't be denied for, right? But insurance companies, they have to follow some sort of process to say, hey, like, if you have this code, like, that's for this procedure, right? And not meeting those things. I understand physicians don't have all the time in the world to manage this. That's why we have billers. But at the biller level, the biller hasn't seen the patient either. So the clinician is left to outsource their problem to someone that can't actually solve their problem. Is essentially the best way I can word that. But
Interesting. Yeah. So you're going to the source of the problem, which is obviously us, the medical, documentation component. Yep. That's super interesting. And obviously making that workflow super simple. So, and you mentioned it's similar to like Grammarly. So is it scanning the text as I type and then giving me suggestions, or what is the plan? Or is it like a workflow window that opens up on the side that then you can kind of click through different things that'll auto populate into the note? I'm curious to know.
Yeah. So right now it's not like in real time. Large language models, AI, it's not instant. Obviously, it takes time to process. So what we have, our current system that we have in place is you document your note, and then right before you're about to lock your note, before your patient has left the office, right? That information is gone when the patient has left office, right? So it'll essentially audit your note and tell you, hey, you're missing these things. You can either go back to the patient to get that information, or you can correct that information on your own if you have access to those labs or imaging, that kind of thing. And then it's essentially like an audit report that it generates. And then it'll give you kind of suggestions on how to correct your documentation rather than just saying like, hey, you're missing documentation, fix it. We're saying, hey, you're missing documentation on these specific things. This is how you can fix it, right? So that's essentially how we're tackling that problem.
That's really cool. And as the co-founder of the company, are you the non-technical co-founder, and then your friend is obviously the technical component, or have you also taught yourself how to code? Like, well, how do the roles kind of vary?
Yeah, so I do have somewhat of a tech background, definitely not as much as my co-founder. That's kind of what he does. He does like all the fancy machine learning, data science, that kind of thing. I do most of I do coding. I took AP Computer Science back in high school and kind of did some coding on the side for just random things during undergrad. I love to, I had a 3D printer, and I would make things, and it's just fun to build things, right? So coding was one thing that was kind of like a side little hobby that I self-taught myself. And I also used a bit of coding in some of my research projects. So yeah, I do have a little bit of the coding experience, but and I do contribute somewhat to that aspect, but most of what I do is kind of on the business side of things, kind of talking to people, talking to your customers, talking to your users, learning from them, I think is the main value that I bring.
And for the company itself, what are the next like sizable goals that you guys would like to achieve from a sense of scale, or what's like the next big project that you're working on that you can tell us at least?
Yeah, so I think right now we're doing more on the R&D side. So kind of submitting for federal grant funding as part of our plan. The NSF has the seed fund where they give you, they have multiple phases. So like phase 1 grants are $275,000, and then phase 2 is up to $2 million. So kind of going through that process of doing the research to prove something that is unproven, and then going to actually developing that project and to be used in real world. That's kind of one of our plans, and then the other plan is kind of to really look for these partnerships at larger institutions, try and work and pilot and just get a lot of data. Right. I think that's the fundamental to business is don't just build things, be able to validate those things with numbers. Right. I think that's really important part of I guess starting a business. But
Yeah, I mean, there's definitely a million different things we could talk about with business, but I'm curious to know how you said that things are kind of progressing in obviously the right direction. You're applying for grants and all this stuff. And, what has been like the, I guess, most difficult part about this whole process as a whole?
I think the most difficult part of this process is definitely there's definitely ups and downs through this whole thing. There's definitely the periods where you're trying to constantly develop something and it's just not working, and then you have this you make it just work slightly better and you're celebrating, right? It's kind of crazy if you look at what we do. Like, we celebrate over the smallest things, because they give us some of the most um, pain sometimes, right? So it's really kind of pushing through that, is kind of the big thing. The other part of it was, at least when we were starting, I had zero business experience. I don't have an MBA. I didn't know anything about business, but kind of finding resources to like help you was really important to us, and was kind of challenging at the beginning because we didn't know where to start. So I know we worked with each state has their like small business developmental center. So we worked with Michigan SBDC, and they've been really helpful in terms of like giving us guidance on like, hey, you should be making a pitch deck. Hey, you should be focusing on this part of your business. Hey, this is how you make your financial projections and make sure that your business is actually going to be profitable, right? And most importantly, trying to do what we do without spending a lot of money, like staying as lean as possible, is kind of really important, because if you can solve the problem without spending money, once you do get money from funding, you could just use it to scale rather than put band-aids on a solution that doesn't work. Does that make sense?
Absolutely. And I think that's great advice too. No one has ever brought up the Small Business Association for each state. I didn't know that that even existed before. We've had a lot of different business people on this podcast before. So that's a great tip. I'm going to look into it too.
Yeah, they're like, I think they're state funded, but they give you totally free advice. You get like assigned an advisor. At least in Michigan, they're vested in your success, so they'll help connect you with whoever you need to be connected with, whether it's customers or whether it's people that are tech focused, etc. So yeah, it's a huge resource.
Wonderful. Well, I'm going to have to look into it as well. And obviously big things coming for Lamics down the line.
Yeah.
But we're getting towards the end of our interview today, and I think it's time for our famous 3 questions. And these are the same 3 questions we ask every single guest on the podcast. So we'll start out with number 1. How do you maintain some semblance of a work-life balance in obviously your demanding profession as a startup founder?
I think that's kind of an ongoing struggle, but I'm still trying to figure that out for myself. I think it's really easy to kind of go down these rabbit holes and get really fascinated about these new research papers coming out on AI, ML, and that kind of thing. So kind of taking a step back and, talking to some of your friends that are not in the startup world and going to hang out with them here and there is something that I've been trying to do more recently. But yeah, you definitely go down rabbit holes as a startup when you're in a startup, and it sometimes when it's your baby, right, you really want to care for it. So yeah, I think for me it's kind of been 1, going to the gym, and 2, kind of maintaining social relationships and not just sitting in my room in darkness all day.
Yeah, that's definitely good advice. And question number 2. Do you have any last minute recommendations for any individuals who are thinking about going through or following in your footsteps, whether that's starting your own business or obviously like thinking about leaving medical school as a whole?
Yeah, so honestly, I wouldn't recommend what I did. I mean, as long as if you can get like a leave of absence or get that kind of stipulation where you're not completely, abandoning medical school completely, but making sure that you're thinking really clearly about what you want to do, and just doing the thing, on the side, whether it's a side project or whatever that might be, and putting the time towards it. So during medical school, I mean, you have to do all these do research and get publications. Why not do those publications or research for things that you like doing, right? Things that can actually impact people, right? Now, I'm a little biased in this sense that, there's the side of the research world where you're doing case studies, those kinds of things, important, but and important for other physicians to be able to use that information, but taking that to another level to understanding, hey, what is a problem that you can solve, and how do I solve it, and how do I research it, right? Is at its core, I think the biggest advice I'd give is focus on a problem in our world and look to explore ways to fix that.
Yeah, a quick side note with that too is like I couldn't agree more. We need more physician innovators who obviously recognize a lot of these pain points, but I think the herd will tend to just say, "Oh, that's just what it is," and move on and just accept that reality. But yeah, we definitely need more individuals who are in the healthcare space that are going to innovate and improve. Otherwise, we'll never get any better.
Right.
All righty. And question number 3, and we kind of talked about this a little bit already, but what are your personal, professional, or business-oriented goals that you would like to accomplish in the next 5 to 10 years?
I think for me, one of my personal goals is to, this is just kind of something that I've started doing, honestly, with the new year, is just read more, just learn more about the world. It doesn't have to be related to what you're specifically doing. Like, we're so hot in the weeds with this insurance industry and medical coding and the billing issues, but just learning about, things related to like what's happening with cancer research, what's happening in the world with different types of technology, just learning about, just learning about cool things, and just reading books that are mentally fulfilling, I guess. That's kind of one of my personal goals, is just to read as much as I can. I think knowledge is power, and you could do a lot with that. There's been things that I've learned and totally unrelated things that have helped apply certain principles to what we're doing. So that. And then on the business side, I think my main goal is to try and obviously make this grow and make this a success. I think the big thing is really trying to work on learning how to manage these partnerships with large institutions. I know that's kind of going to be the fundamental thing that pushes us forward, is having support from those that have, the resources to make this work. So establishing those partnerships. And yeah, I think just learning about business, I'd say as a whole, is something that I'm trying to do. I know I'm still fairly new to this, but I know I have a lot to learn. So yeah.
Absolutely. Well, I look forward to seeing Lamics on my EMR in a couple years.
Yeah.
All righty. Well, we've come to the end of our interview today, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, pharmacy practice, or entrepreneurial topics, check out my website at www.physicianpharmacist.com. Before we let you go, Sash, where can our listeners get in touch with you or learn more about you?
So you can contact me. I could give you my email, and then you could just email me. You could put it in the comments or the description section or something, or you can visit our website and contact us there. Yeah.
Sounds good. Yeah. And all that will be linked down in the show notes below. Well, thank you so much for your time tonight. I know you're an extremely busy individual, so I really do appreciate your time and for chatting with me tonight.
Yeah, no problem. Thanks for having me.
All righty. Take care.